Sydney is 13 and Sheridan is 9. I wondered how we were going to manage having 2 children with this disease. It's scary in that I don't know what the future has in store for them. Sydney, she's a very strong person and she knows what she wants and she's going for it. When she was younger, she had more problems with sickle cell disease. She had frequent pain crises.
God is good. God is good.
This is a genetic disorder. For a child to end up with the disease, both parents must carry the trait. The hallmark of this disease is anemia, which can cause fatigue, but also pain. The reason for the pain is the abnormal red blood cells in this disease, which pass poorly through the blood vessels and therefore sometimes cause obstruction, blockages of blood vessels.
She'll be on this medication for the rest of her life. There is no shame in her acknowledging this disease, and I think that's phenomenal. She has achieved great things thus far in her life, from being an honor roll student to currently being a cheerleader. She's one of the lighter people on the team, so she gets to do a bunch of stunts and, have people help hold her up. It goes along with the sickle cell disease. She has this base underneath her to help give her strength. Sheridan brings a smile to all around her. Even though she may be the sick one, she still has the ability to make the doctors and nurses and anyone who interacts with her smile. There are some academic struggles that she is facing. Through neuropsychological testing, we found out that she has some difficulty with how she processes information. Maybe about a year or 2 ago, Sheridan had to get an arterial blood draw. It was very traumatic, but I remember Sydney being in the background and just giving Sheridan words of encouragement. Sheridan gained strength from Sydney. I remember after the procedure was done, kind of went and hugged each other. I guess they gained strength from one another.
I don't see them ever allowing this to beat them down. They inspire me. They keep me motivated. They keep me going.
We've been at UNC Hospital since Sydney was born. We have a very close bond with the staff there. Honestly, I feel like the doctors are like our family. I feel like they have a vested interest in our children, making sure they get the appropriate rest, to make sure they stay hydrated and take their medications like they're supposed to, go to the doctor frequently.
Our favorite room, the big room. There you go.
Dr. Rupa, she's tracked both these girls since they have taken their first breath. That's that personal touch that you just can't get anywhere.
Check for lumps and bumps. Have you noticed any lumps or bumps? No. Pain is the primary problem in sickle cell disease. And if you can imagine what it's like for a very young child suddenly to have extreme pain. Does it hurt now at all?
It just felt like really achy.
When it gets bad, and this has happened with Sydney, she has to come into the hospital to get IV pain medication because oral pain medication isn't sufficient. But you could always call me. Okay. If we look back over the last 30 years in the care of people with sickle cell disease, we've had dramatic improvements, particularly for children.
Sydney, I have some gravy over here.
The life expectancy for a child with sickle cell disease is getting close to that of a non-affected child. Sydney and Sheridan are very special girls. I foresee very good futures for them.
They are hungry for life. It helps me to allow them to go out there and live their lives and enjoy things that children in their age group are enjoying. Yes, I'm scared, but I am definitely hopeful. I just know that sickle cell disease is not going to dictate who they are in life.